Welcome, everyone. Hello, hello. I'm just going to give another couple seconds here to welcome everybody to today's webinar. I'll introduce myself. I'm Dr. Danielle O'Connor. I'm a naturopathic doctor. I've been in practice for over 20 years in the Oakville and Burlington area. So I just would like to say hello. Hopefully everybody is either eating their lunch now and can sit and listen for a little bit. But I'm really excited today. So we have Dr. Andrea Picardo here. She's also a naturopathic doctor. And today she is going to be talking all about pregnancy. It can be a really overwhelming time. I know this, I have 4 kids myself, so it can be very, a very difficult time with a lot of information. So luckily we have Dr. Andrea here today. We're going to be covering topics like nutrition, the benefits of really comprehensive blood work, how naturopathic medicine can provide support for, different concerns that arise during pregnancy, whether it's nausea, which is quite common, hypertension, constipation, all sorts of different topics we're going to cover today. So first off, I just want to start by welcoming Dr. Andrea. Thank you so much for being here. And I'm going to pass the mic over to you so you can introduce yourself and just tell us a little bit about yourself and your practice.
Yeah, sure. Sounds good. So as Dr. Danielle already mentioned, my name is Dr. Andrea Picardo. I am a naturopathic doctor as well as a birth doula. And I practice in 3 different cities. So Milton is one of them. I work at the World of My Baby, or also known as the Womb. Toronto is my second practice location. So I work at Hillcrest Center for Health around the St. Clair and Dufferin area. And finally, I work at the sister clinic to Hillcrest Center for Health called Clarkson Family Naturopathic in the Clarkson area of Mississauga. So those are where I see in-person patients, but I also see patients virtually across Ontario. So that's the benefit of virtual care. My practice focuses, I really niched down quickly because I just loved seeing all of these different populations. So I started off with pediatrics because I was chosen for the competitive pediatrics focus shift during my internship. And then from there, I expanded into fertility, pregnancy, postpartum, because they're all so intertwined. So I focus on what I call the 4 Ps, 4 Ps. So preconception or fertility, pregnancy, postpartum, and pediatrics. And essentially, as a naturopathic doctor, what I'm doing is focusing on that space between doing nothing and then needing medications or surgery. So really working with nutrition, lifestyle strategies, evidence-based supplements, acupuncture, and then maybe some botanicals and homeopathics, really individualizing it to the person.
Wonderful. That is a great introduction. I love that you have multiple locations so you can really service people from all across Ontario. So wonderful. And I will mention, if anybody has any questions, please feel free to put them into the chat. We are also linking Dr. Andrea's information for her contact as well as her socials there. So please follow her on social as well as us here at Health Buddha. But let's get started. Okay, so I've got a lot of really great questions for you here. And I think these will really be great in terms of just some general information about pregnancy and hopefully taking people out of that overwhelm and just kind of making sense of things, right? So first off, for your patients are coming in, they're pregnant, what are some tests that you like to order as a naturopath for your patients? What are those important tests that they should have?
Yeah, so testing is a big part of my practice because I think it's really important to get a full picture of what is going on. And I find with pregnancy care, sometimes people are coming to me and they haven't had blood work done in years. And all of a sudden they're pregnant, and there's so many different nutritional needs that can often go missed. So you'll have your basic blood work, but I just like to make sure that we're screening often enough. So primarily, I do work with blood work. I find it's the most evidence-based way to work with things for pregnancy. But first off, I like to test iron. Iron is something I'm so passionate about because it's so connected to so many pregnancy outcomes, postpartum outcomes, labor and delivery outcomes. And we're often just screening people maybe in their pregnancy once, and then we don't often look at it again unless there is some iron deficiency going on. But often, like patients are coming to me already iron deficient, and we have to deal with that as well as the different metabolic changes that happen during pregnancy. So like if we look at it, 40% of pregnancies are iron deficient globally. So when I'm testing for iron, I like to test for the storage form of iron, which is ferritin. I also like to order a transferrin saturation to really rule in whether it is actually iron deficiency, anemia, or if there's higher levels of ferritin that are associated with inflammation, which we'll talk about in a second. And then a complete blood count. So those are very basic blood tests. Typically, I like to make sure that ferritin is at least above 30. Ideally, we want it above 100, and we're working on this ideally during our preconception care, just to give the body a good buffer during pregnancy, because we need to really distribute those stores of iron. So if a person is struggling with brain fog, with fatigue, with shortness of breath, with small activities like going up the stairs, with heart palpitations, that's really ringing those alarm bells off in my head. And often, if there is iron deficiency, a prenatal is not really sufficient to accommodate for that. So making sure that we're also taking care of it through an additional supplement if needed. So when it comes to iron, we have to consider like what is happening during pregnancy. So often we have this increase in fluid volume, and then later in the pregnancy, the body catches up by producing more red blood cells. So that's later in about the second trimester. So we need to have enough iron to make sure that we are keeping up with those needs. If there is low iron, then we have a higher risk of preterm delivery, higher risk of postpartum anxiety, depression. There's also the challenge of if you're losing blood during labor and delivery. So making sure that we have enough stores for that, to accommodate for that. And then you're also passing on your iron stores to baby. So babies who have iron deficient moms are going to be iron deficient as well. So we can kind of get around that with delayed cord clamping, that's something I might mention later as well. But just so many different things with just such a simple blood test can be avoided. And we know that iron deficiency is one of the most common nutritional deficiencies in pediatrics, and it can really impact cognitive health. So we're really thinking long-term with that. So that's a first one that I always like to look at, and then looking at the specific numbers as well. Another thing that it can impact is restless leg syndrome as well. So if patients are under 75 for their ferritin, then treating with iron can be really helpful to accommodate that. And then, as I mentioned, so you want to make sure that ferritin or your iron stores aren't elevated falsely because of inflammation that's going on in the body. So I also like to order inflammatory markers, consider health history before you have conceived. So if there is anything like PCOS or any metabolic disorders, sometimes ferritin can be higher because of that. So if you're getting a requisition from your doctor, looking at CRP or HSCRP is really helpful. That can be a marker for cardiovascular inflammation. And like the placenta is made up of blood vessels, so that is something that I love to consider. ESR or erythrocyte sedimentation rate can also be a very general marker of inflammation. So yeah, just making sure we're pairing that to fully understand what's going on in terms of your iron levels. Vitamin B12 is also something that I like to look at, especially if a patient is vegan or vegetarian before they're conceiving, because those levels can be lower in those populations. Vitamin D is also a very big one, something that I always rant about this in appointments, but we just do not measure it enough. And especially living in Canada, it is such an important nutrient to measure. And especially a lot of people that I see are walking around with fatigue, brain fog, poor immune health. So it's such an important marker that we don't always look at. Also in terms of hormone health, carrying to term, you want to actually aim for levels of about 100 nanomoles per liter. So that's what the research has been showing. So that is a marker that I love to measure, because they assume that all Canadians are vitamin D deficient, which is a correct assumption. But the way that it's been gone about is not something that I agree with. It's for that reason, since we're most likely deficient, they don't cover it by OHIP. So it's about a $35 to $40 test, but it can really tell us a lot of valuable information for having a healthy pregnancy. And we also want to make sure that if we are dosing vitamin D, which is one of the most common over-the-counter supplements that we're taking, we want to make sure that we're dosing adequately, so taking enough to achieve outcomes, but also not going overboard, because it's a fat-soluble vitamin. It can accumulate in the body and it can lead to toxicity symptoms. So that is something that I really, really like to measure. And in the context of pregnancy, it actually helps with preventing small for gestational age babies, preterm birth, placental complications. They actually found in a study that placental complications are 5 times more likely after 32 weeks if you are vitamin D deficient. So very important value to look at.
Yeah.
And then just a few more that, and I want to preface this that I'm not ordering these tests for everybody. I like to go through the health history to see what is most important for your picture. So some other things that I like to look at are thyroid health. Our pregnancy hormones are very similar to our thyroid hormones. So it's more likely that the thyroid will go awry once you're pregnant. And you want to aim for specific values. So the TSH, which is how our brain communicates to our thyroid, is the range for that is about 0.3 to 4. And that is a very, very wide range. The research is showing that it's better to be at less than 2.5. So that to maintain a healthy pregnancy. I also like to look at thyroid antibodies if there's a strong history of autoimmune concerns. And if you have certain symptoms before conceiving, because the thyroid can go awry if there is any autoimmune disease that's happening. So things like Hashimoto's thyroiditis, our thyroid antibodies will be elevated in that case. And this can happen years before there are any changes to our TSH value. So I like to look at this ahead of time in a preventative way because it can impact our ability to conceive. It can impact our ability to maintain a healthy pregnancy. It can impact our or increase our risk for certain things like preterm birth, increased risk for gestational diabetes, increased risk as well postpartum for postpartum thyroiditis. So I like to look at that as well. And then from a cardiovascular perspective, fasting insulin, so looking at insulin resistance, homocysteine can also be really helpful. Because they're very, very related to how we are building blood vessels and health of our blood vessels. And like I mentioned before, placenta is just all blood vessels. So those are important values to look at. And then finally, blood pressure. With the switch to virtual care during the pandemic, that has been something that has been basically going like a lot of people have not been having their blood pressure managed and or measured, sorry. And if that's higher, you do want to look at other values like urinalysis, liver enzymes, creatinine, uric acid. So just getting a full picture. But if you haven't had blood work done in a while, getting a full panel of your health is really important.
Yeah, absolutely. Wow, that's great information. I loved really how you mentioned, first of all, it is like that individualized approach, right? So really basing these tests, obviously, a lot of them kind of have to be done during pregnancy, really, but how you do take that approach based on your patient needs. So that's fantastic. And I think that was really great information on the tests that people may not necessarily be getting, very full comprehensive testing during pregnancy. So, and obviously the reduction in risk factors, right, of knowing where their levels are for a lot of these is really, really important. So that is wonderful. So I love the information on the testing. Now I want to segue a little bit into, just some of those common things that women, struggle with during pregnancy and how naturopathic medicine can help support things. So, some of the typical ones I'd say are like fatigue, nausea, even, constipation, insomnia, like some of those things. Is there things that naturopaths can do to help people? And what are some of those ideas that you usually discuss?
Yeah, so there are so many different concerns that can pop up during pregnancy, but the most common ones I do see are fatigue, especially in that first trimester. There's so much transition that's going on. So I guess I'll start there, but basically screening for the markers above is really important. And like I said, they're not always screened for. So I can provide requisitions in practice, and I am finding now that I'm having good luck with having them covered by extended health benefits. So sometimes I'll just do an additional requisition if somebody has to get blood work done because it's been really tough for people to get into their family doctors. So yeah, just making sure that we're screening for those markers that I mentioned. And then fatigue can have such a multifaceted, or it's just such a vague symptom. Like it can be associated to so many different things. So just making sure we're doing a very good workup, not just health history, but current health. So things like nutrition, digestion, sleep, energy, stress. Are there any places in your foundations for health that we can provide some support that might be associated to your fatigue? So we're making those small manageable changes over time and hoping to see some benefit there. So yeah, tweaking nutrition is a big part of what I do. And then maybe I'll do some supplements to help if there's any adrenal support that I think needs to be done. And with any supplements that are recommended, they have to be safe in pregnancy. So I make sure that that is also considered. And especially in different trimesters, there can be higher risk than others. So I do like to consider that. Nausea is also a very, very big one that I see in practice. So there's a kind of a spectrum with nausea. Sometimes it's that typical, I hate that they call it morning sickness because it can happen throughout the day. But there's those milder forms of nausea where you're not necessarily vomiting. And then it can range to hyperemesis gravidarum, where you are just so nauseous, vomiting throughout the day, actually losing weight because you can't keep anything down. So I like to screen for that as well. So if you have a milder form of nausea, really working on nutritional counseling. So for example, eating smaller portions throughout the day, maybe aiming for higher protein in your meals and snacks to balance blood sugar, because sometimes blood sugar drops can actually be associated with nausea. Maybe having some like crackers on your bedside table, having those in the morning can sometimes help with that. Having things that are easy to digest. So soups, I've had a lot of success with people having miso soup, potato soup, or just generally soups, because the veggies are cooked, or everything is cooked, so it's a easier load on the digestive system. Also, baking your veggies, smoothies are also really helpful. Trying to separate fluids in meals, I've found some benefit there. Lifestyle things can be reducing smells in the environment, or actually finding a smell that you enjoy and then carrying it with you. And actually, interestingly, there was a study on sniffing rubbing alcohol for reducing feelings of nausea, and they found some benefit with that. So
Oh,
worth
wow.
it to
Never
try.
heard of that
Yeah.
one before. Yeah.
Yeah, so worth it to try if you have some lying
Yes.
around at home, or even when you're like in the hospital during labor and delivery. Sometimes that's something I'll do with my doula client, and they'll experience some benefit with that. Or even like placing slices of lemon and ginger in a slow cooker or a pot on the stove, and just letting that smell up the environment. So just some little tips and tricks like that. And supplements wise, ginger can be helpful. Higher dose vitamin B6, tissue salts, acupuncture. So it really depends on the person and really individualizing it, because sometimes people will experience that nausea but have symptoms of heat, or like they prefer like colder things. So ginger is a very common supplement that's recommended on the internet, but it can actually aggravate nausea for some people if they struggle with a lot of heat system or symptoms in the digestive tract, since it's so warming. So just an example where that individualized approach can be really important. Reflux is something that I see a lot, so very similar to nausea.
Yeah.
Like those recommendations, and this is often later in pregnancy that I'll see it. So very similar recommendations to nausea, but supplements wise, recommending things to coat the throat. So a good calcium magnesium supplement can really help because of the chalky sensation, or slippery elm, DGL, deglycerized licorice can be helpful as well. Constipation is another thing that I see quite often, and hemorrhoids. So working with water, fiber, making sure that you're getting enough, and maybe recommending some lifestyle things like squatty potties and stuff like that. Or osmotic laxatives like magnesium can be really helpful there too.
Yeah.
Were there other ones? Sorry,
I
I think I
know, I know.
missed.
No, you know what? That honestly, that is such great information. Like I think you've really given us a lot on that, and just a lot of things to think about. So obviously, like dietary wise, there's changes that can be made. There's supplements that can be taken, herbals, even like when you were talking about like the different smells, and that you have that experience as a doula as well as a naturopathic doctor, and bringing all of that together for your patients, I think is just amazing. And one of the other things that you brought up that I think is probably one of the most important things is how you mentioned the safety of things, right? So, people can go and they can look on Dr. Google and they can find different things of like, oh, I can try this and I can try that for, whether it's nausea or reflux, or fatigue, that type of thing. But to really have that professional and that naturopath that they can lean on and be able to speak things, talk things through in the sense of, is this safe for me? Because there are a lot of supplements out there that aren't safe, right? And so to really have proper treatment plans through a regulated individual, I think is really important, because you can never be too safe, right, during pregnancy. So yeah, I think that was wonderful information. And yeah, I think you gave us a lot of great information. I didn't see any questions in the chat, but we do have your contact information here. So, and if anybody wants to reach out to Dr. Andrea, you can book a free discovery call, which she offers, which I think is wonderful. So please feel free to reach out. And honestly, you've got such great information. I'd love to have you back for, to talk through even more information regarding pregnancy, whether it's about, just different types of treatments like acupuncture, acupuncture, as well as maybe even preparing for pregnancy. So hopefully you will come back and chat with us. And I just wanted to thank you so much for being with us today. And this is great information. So I appreciate it. And yeah, hopefully everyone has a wonderful day. Thank you so much.
Thank you.
Okay, take care, everyone.